So our study was personalized molecular match therapies for carcinomas of unknown primary. Carcinoma of unknown primary is a rare tumor diagnosis that makes up about 2 to 5% of all cancer diagnosis worldwide and represents a heterogeneous group of cancers. So the unmet need of this study is that these patients fall into a category where they don't have a specific tumor diagnosis. So the standard of treatment includes combination chemotherapies with modest response rates between 20 to 40% and overall survival that's poor with 6 to 15 months on average. So in this study, we had 97 tumor samples. With 74 of them got tissue next generation sequencing, 72 of them had cell-free DNA next generation sequencing. And what we did with that was we found that the number of alterations in NGS on average, the median was 4 with a range of 0 to 25, and the median for cell-free DNA sequencing was 2 with a range of 0 to 9. We also had PDL1 staining, microsatellite instability, and tumor mutation burden in select cases. From there, we did what's called the matching score, where we looked at the number of targeted deleterious genomic alterations and divided that by the total number of deleterious alterations, where we matched drugs to the target of the specific alteration. So what we found in this study was that the most commonly altered genes in tissue NGS were TP53 followed by CDKN2A and KRAS, and in cell-free DNA were TP53 followed by KRAS and PIK3CA. We found that about a third of patients had PDL1 positivity, where we had at least 1% on tumor staining, and about 10% had high tumor mutation burden, and about 3% had MSI high testing. So from there, we found out that patients with a high matching score, defined as greater than 50%, versus low matching score of less than or equal to 50%, including 25% patients with no matched therapies, had a statistically significant longer median progression-free survival of 10.4 months versus 2.8 months, and a trend towards significance in overall survival of 15.8 versus 6.9 months. We also calculated the disease control rate, where we define that as stable disease for greater than or equal to 6 months, plus a partial or complete response, and found that patients with high matching score versus low matching score had, again, statistically significant higher disease control rate of 71% versus 24%. So the impact of these findings is that we've identified that patients with CUP have alterations that potentially could be targeted with targeted therapies. We also find that patients with CUP, personalized combination approaches with high degrees of molecular matching or a matching score of greater than 50% are associated with improved outcomes. So future directions include more prospective trials looking at matched targeted therapies, including combination therapies, to try and improve outcomes over standard of care for patients with CUP. Yeah, no, I think the interest and the implications of this study is that in a cancer of unknown primary where you don't have a specific tissue, we've shown that when you target combination approaches and when you give multiple drugs to the patients, they do better based on their NGS report. And I think this can be translated, or at least tried to be translated, to other cancer entities and treat them more specifically based off of their mutational aberration patterns.